we've got a really great panel of here this evening. Michael Frierson, who's a Cal Poly Pomona alum. His son was diagnosed with colon cancer at the age of, I believe, 32, and he passed away at 37. His surgeon and colorectal specialist, Dr. Zuri Murrell, is on the panel with us this evening, and will be moderated by Dr. Sherilyn Cook, who is a Cal Poly alum and also a physician. I'm going to give you a quick introduction of our panelists, and then we're going to get started with this discussion. Dr. Zuri Murrell is a leading LA colorectal surgeon and specialist. He's currently chairman of the committee on the Samuel Oshkin Comprehensive Cancer Institute and physician member on the board of directors of Cedars-Sinai Medical Center. He's currently serves as the medical director of outreach and quality integration for Cedars-Sinai Samuel Oshkin Comprehensive Cancer Center Institute. He also is chairman of the Cedars-Sinai Physician Medical Staff DEI Task Force. His previous positions included director of the Colorectal Cancer Program from 2012 to 2018. He's the clinical chief of colorectal surgery from 2012 to 2014 and attending surgeon at Cedars-Sinai Medical Center. Dr. Murrell has gained certification with the American Board of Colon and Rectal Surgery since 2008 and the American Board of Surgery since 2007. With his own practices located in Beverly Hills and Los Alamitos, California, lacolonrectalsurgeon.com, and published over 40 times in articles and book chapters. Dr. Murrell specializes in the diagnosis and treatment of a spectrum of colorectal functions, including hemorrhoids, colon cancer, rectal cancer, Crohn's disease, colitis, IBD treatment, and colonoscopies. Also the developer of anal rejuvenation with the goal of repairing any abnormalities and restoring your anal region to its original form. I bring you Dr. Zuri Murrell.
Thank you for having me.
Next up, I want to introduce Michael Frierson. Michael is a graduate of Cal Poly Pomona. He was a colleague of mine during my 4 years on campus. And 40 years ago, we never thought that we'd be looking like we look now, and the same deal. And working together on such an important issue here. It's a tragedy that he's experienced, and he's determined to keep as many people as possible from having something like this occur to them. He had a career with Fresenius Medical Care. He was Senior Director of Business Development with Fresenius Medical Care, Senior Director of Managed Care, Director of Sales, Regional Manager, and Sales Representative. He was a professional baseball player with the Seattle Mariners, probably one of the most diversified athletes that we ever saw at Cal Poly, as he played baseball, football, ran track, and he was a hell of a basketball player too. And then finally, we have our moderator, Dr. Sherilyn Cook, and Dr. Cook was also a alumni at Cal Poly Pomona. She came in during my senior year at Cal Poly. She is Dr. Sherilyn Cook, MD, Masters of Public Health, is an internal medicine specialist with over 20 years experience as a primary care physician, and is currently the public health officer for Nevada County, California. She's serving as president of the Sinclair Miller Medical Association, the Oakland, California affiliate of the National Medical Association. Sherilyn is a native of Los Angeles and grew up in Compton. She completed her bachelor's degree in biology at Cal Poly University Pomona, a Master of Public Health at UCLA, and a medical degree at Stanford University. So with that, I'm going to turn it over to Dr. Cook. She'll be moderating, and we'll get started, and then we'll have some, please submit your Q&A on the chat, and we'll integrate the questions along the way.
Okay, thank you very much. I'm happy to be here, and thank you for your interest in tuning in this evening. But I'm thinking we'll start with maybe Michael sort of giving your personal story of what happened and how you came to meet Dr. Murrell.
Okay. First of all, can everybody hear me? I'm not on mute or anything like that, eh? My son Michael was diagnosed with colon cancer at age 32. The first time, well, actually, we didn't know exactly what Michael had when he first started showing symptoms of being sick. We knew he was anemic, but we didn't know the extent of his anemia until he and I were like working out one day, and he couldn't run 10 yards. So we wound up taking him to his physician to get him checked out. They did a multitude of tests on Michael before they gave him a colonoscopy. I mean, a colonoscopy was the last thing that he received during this process of finding out what was wrong with him. Tested him for leukemia before they tested him for colon cancer, or before they gave him a colonoscopy. The first colonoscopy was misdiagnosed. So he went a year being treated for something that he didn't have. Then he got sick again. He started feeling better, then he got sick again. So we were recommended, Dr. Murrell was recommended to us. We went and saw Dr. Murrell. Dr. Murrell did another colonoscopy. And if I'm not mistaken, when we looked at the two colonoscopies side by side, they were pretty much identical. I'm going to have to ask Zuri if that was the case or not. But literally, he went a whole year in a situation where he should have had some type of more extensive treatment. At that point in time, Zuri told Michael that he was going to have to remove his colon. So as we get further along in this discussion, I want you to understand that Michael didn't have a colon after 2015, 2016. I think it was 2016 it was, Zuri, I think he took his colon out. And 2016, Michael didn't have a colon. And I say that simply because I want people, I try to point out to people that, this colon cancer issue is real significant. I mean, people don't necessarily die from colon cancer. I mean, what they die from is how aggressively the cancer metastasizes outside of the colon once you have it, once you've been diagnosed with colon cancer. But, Michael lived for 5 years, and, we thought he had beat it. A couple of times, I mean, Zuri and I really thought he was going to be that rare guy to get through this thing. We thought he had beat it 2019, 18, 19, it came back, and it came back so aggressively that, we all were surprised. In 2022, he passed. But 2021, he passed, I should say. So
And then Michael, one thing I wanted to, I'm sorry to interrupt.
Yeah, go ahead.
Because he was misdiagnosed that year when we actually did the surgery, he was advanced. He had stage 3, he was advanced. And that's why he had, one of the reasons he had a poor outcome because of that delay. He was stage 3 at diagnosis versus, he shouldn't even have had cancer.
Yeah. Well, like I said, you got to live with those circumstances. But once again, we thought we had beat it. And it came back super, super aggressive, and he didn't make it. But this was a difficult situation for all of us at the time. And I can say one thing: he handled it really, really well as somebody can handle a situation, knowing that, especially when you get to the end times of this, understanding that you're not going to make it. I mean, and there, like I said, when he realized that, he still handled it with a lot of dignity. My main goal with this is to make sure that nobody under the age of 40 has to go through this again, because this is senseless. I mean, the more I've been involved with this and the more I've been around Zuri, you understand that, people don't have to die from colon cancer. I mean, they don't. All we have to do is be smart as a society and make sure that we're, people are getting colonoscopies as early as they possibly can. I mean, my main goal in this is to try to raise about $200 million so I can get free colonoscopies for 58,000 to 85,000 people under the age of 40 years old, actually under the age of 45. For two main reasons. Number one, it's the right thing to do. I mean, it is the right thing to do. We are in the beginning stages of an epidemic, and nobody's talking about this loudly enough for society to get ahead of this thing. So first of all, it's the right thing to do. But secondly, if we could get that many people, that many young people to get colonoscopies, can you imagine? And they're willing to share that data. Can you imagine what that would do to the to how the industry today views colon cancer? I mean, because we're working on data now, the determination of a person getting a colonoscopy at 45. I mean, that data is 25 years old. I mean, and that doesn't make any sense. I mean, we're totally different. And Dr. Murrell is going to talk about the significance of what's going on now versus what was going on 15, 20 years ago. I mean, everything has changed.
I was just going to interject a question for Dr. Murrell because, obviously I'm before you, but, the common teaching was when we were in medical school, this is something people 50 and over. And there were even arguments that, no, you need to be 60 or 65 to be screened with a colonoscopy. And now we're seeing it in people much younger. And maybe we were just ignorant before, I don't know. But what do you think is really driving particularly higher rates in African Americans and higher rates in young people?
Right. So traditionally, colorectal cancer was you get cancer at about age 65. That was very common, but colonoscopies were done at age 50. And there still is a majority of colon cancers still do occur over the age of 50. But we've seen a 12-fold increase in people under the age of 45 who have gotten colon cancer. And now you have a higher chance of getting colorectal cancer if you were born in the 1990s than if you were born in the 1950s. And so this has been an epidemic. While we think, we're not sure why, because some of the risk factors traditionally that affect colorectal cancer that we all learn and is correct for a majority of people is obesity. So obesity in and of itself is a inflammatory condition in your body. Okay, it actually, your body fights itself. So you spend less time actually fighting the changes that lead to cancer, number one. We know that vitamin D levels, for instance, are very important in terms of having normal vitamin D levels, okay? Those things are very important, especially in people over the age of 50. Exercise, family history, things of that nature. One of the reasons we think we're seeing such an increase is the diet of Americans, 18 years and younger. 75% of it is highly processed foods, 75%. 75% of millennials will be obese, not overweight, will be obese by the age of 40, okay? The reason that highly processed foods are so bad is in addition to the fact that your body breaks them down into pro-carcinogens, things that could lead to cancer, we're starting to think that it changes the microbiome of the gut. So the microbiome are the bacteria that basically line our intestine. People forget this, but the skin is one of our largest immunologic barriers. Second is the GI tract. Okay, so the GI tract is covered with good bacteria and bacteria in harmony. We think that the diet is what is changing our microbiome so that we're more susceptible to colon cancer. But it's an epidemic that really could be prevented, with the proper treatment with colonoscopies. I know Michael had one and was, misdiagnosed. That is not the norm. There is about a 4 to 5% misdiagnosis. However, to be quite frank, that should have never happened. It should have never happened. That being said, it's important because the reason colonoscopies help to prevent colon cancer, and I know most people probably know this, is it comes from polyps. All colorectal cancer comes from these small growth polyps. Polyps have no symptoms when they're small, but they can be removed during a colonoscopy. So you prevent cancer. It's literally I take it back. It's one of two cancers that are preventative. Cervical cancer is preventative when women get their pap smears and you see changes and you remove it before. And colorectal cancer is preventative when you not only, eat right and do all of the things that are important, which we can talk about later, but it's also, colonoscopies actually help prevent cancer. There's other tests that we were talking about, such as the FIT test and the Cologuard test, which looks at stool changes. Those are pretty good at finding cancer. But the point of all this is prevention. And so colorectal cancer is number 2 cause of cancer-related death for men and women, yet it is so preventable, especially for people over the age of 45, because you're supposed to, get the colonoscopy. But we're starting to see, and it's starting to be medically not just proven, but the thought process is if we can do it younger, then you can prevent more. So.
You're on mute.
Can't hear you,
muted, Dr.
Sherilyn.
Cook.
Sorry, I unmuted myself. I just wanted to comment that back when I was a kid, the amount of processed food that we ate was far less than it is today. I mean, going to McDonald's once a week maybe was a treat. And now there's kids, you'll talk to kids in high school. It's like pretty much every meal is a processed food.
And Dr. Cook is hard because I remember my family, we were like probably middle class. I was always the first, my parents were social workers. I was always the first one to get dropped off at school and the last one to get picked up. And I remember, you're driving home. I'm like, Mom, I want McDonald's, but it was cheaper to cook at home. And so, whether I wanted it or not, we're going home and my mom was going to cook a healthy meal. Now it's actually cheaper, to go to McDonald's, to go to KFC all the time. It's actually cheaper. And so it's really hard, when I give talks and especially I do a lot of talks, at churches and a lot of talks in the inner city. It's hard for me to tell a parent who works all day, and your kids are crying and it smells good and it fills you up. It's hard, especially with a lot of what we used to call food deserts. We call it food apartheid now. It's hard to actually get those meals that are healthy, and especially when it's cheaper, and that's a huge problem that may be, bigger than this particular conversation. It's difficult, it really is hard, but that's really the only way we're going to make a difference. Like we're having this talk now, but most people on this Zoom are probably over the age of 45. I'm 48. The key is really how we train our kids. Number one is teaching them their family history, not about just colon cancer, but about polyps, right? I always share a story, and Michael knows this, is my dad got a colonoscopy, and actually first he was offered a sigmoidoscopy. Now a sigmoidoscopy is done without anesthesia, and it looks at the lower third of your colon. African Americans, most of our polyps and cancers on the right side. So it's literally it's not useless because it does, if you find polyps there, it does trigger a full colonoscopy. And in America, that test has been one of the biggest reasons why there's a decrease. There was an overall decrease in colorectal cancer, however, not for African Americans. Okay. However, it also stops people from wanting to get a colonoscopy because you're awake when you have a sigmoidoscopy. You're not comfortable. And so a lot of times it keeps you from getting the actual colonoscopy. So my father had his sigmoid and he was told it was fine. And he walked home. I'll never forget. He drove home and he's like, I can't believe you do this for a living. That was so painful. And I was like, Dad, what test did you have? He said a colonoscopy. I said, that's impossible. He drove himself home. So he never had that, but he was offered a sigmoid. So I, got on the phone, called his health system, had a colonoscopy, and he literally had 4 polyps that were about, 2 inches. We say, about 4.5 centimeters from the end of the sigmoid. Okay. So he's had subsequent colonoscopies, and he has a total of about 8 to 12 polyps. Because of that, I got my first colonoscopy at the age of 42, and I had a 2 centimeter high-grade dysplastic polyp. And so high-grade dysplastic means it's it would have been cancer within a year, and I only got that because I knew my family history. And that's one of the biggest reasons why I also think that 30-year-olds need colonoscopies, because if you don't know your family history, a lot of people, I mean, a lot of my friends didn't grow up with, both their parents. A lot of them don't know their family history. There's another reason why, if you don't know that history, then it's worth getting a colonoscopy early, because, you don't know. You don't know. And I think
that was
that's
one of the
important.
questions that came in, Dr. Murrell, is what age should one get a colonoscopy, and will insurance pay for it?
Right. So at 45, you definitely need so a screening colonoscopy means that there's no family history and there's no symptoms. So symptoms of colorectal cancer are rectal bleeding, which is very common. Rectal bleeding, it is change in bowel habits. So if you go every single day, like clockwork, and over the course, of a month or so, you notice that you're going once every 4 days or something like that, once every 3 days, and you try over-the-counter remedies, then you need to see your doctor if those don't work, because there could be an issue. But the problem is all of these are very generic, right? And so it is the silent disease, because it can grow from a polyp to a cancer and you don't know it, okay? So the reason that the age limit was dropped, so it was traditionally 50 for a colonoscopy. It was dropped to 45 initially for African Americans, because we have a higher rate of death once discovered, higher stage. Once colorectal cancer is diagnosed, highest death, okay? So the age was decreased to 45. However, it was still hard for African Americans to get that colonoscopy. And the reason being is, they've done studies where every time there's a difference in treatment, every time, or outcome between Blacks and Caucasians, everybody says, well, Caucasians have money, Black people don't, it's social economics, all this, right? We do know that first of all, that's not true. But when they did a study looking at wealthy African Americans versus wealthy Caucasians, middle, poor, and found that offering of a colonoscopy was the same, with African Americans saying that they have not been offered a colonoscopy. Now, often the same doctors who saw these patients would say, well, patient refused a colonoscopy, okay, things of that nature. So anyway, it was reduced for African Americans 45. 2 years later, it was reduced to 45 for the nation, okay? The thought was, because colorectal cancer happens at 55, 60, then you're doing a good thing by getting the colonoscopy at age 45, because then you would prevent it later. So screening, no family history, no symptoms. Now, the reason I harp on that is that if you have any of these symptoms that are rectal bleeding, changes in bowel habits, and hemorrhoids have been ruled out, things of that nature, by a specialist, then that could trigger a colonoscopy. If you know your family history, if you know your polyp history, you get it early. Now, traditionally, if you have a family member, first degree, who got colorectal cancer, let's say they were age 50, then you should have yours at 45, okay? It is starting to be debated that maybe, we need a screening colonoscopy at age 30, because we're seeing such an increase in cancer that in young people, that maybe we should get one earlier. And if you get it earlier and there's no polyps, then perhaps you can then wait till you're 45, right? And now when I say this, Zoom is going to go, all over the globe. A lot of doctors push back, okay? And it's not the standard of care. So what I'm telling you is what I do think will be the standard of care eventually, okay? But a lot of times when we have these standards, it's important to remember it is because we, have to make sure that the whole country can follow our standards. There's not a lot of GI docs in the South. There's not a lot of, doctors like me in the South. You could throw a rock in LA and hit somebody like me. Not as good as me, but you can hit somebody like me. So
we had a question that came up from Cheryl Lynn, and since she's almost got my name, I have to call on her.
Yes,
if you can unmute.
Oh, good evening, namesake. I do have to say this before I get to my direct question. Did you present last time we had something like this a year or two ago? You were one of the presenters, Sherilyn, and Mr. Frierson, were you here? I'm trying to think. I thought I recognized.
All three.
Okay.
Mhm.
Okay.
And I want to make a comment after you ask your question.
Okay. First of all, I have to say that this was pretty much, I think that was, again, 20 or 21. It was life-saving for me because I was one of those who, because of the pandemic, was not going for my regular checkups. Sherilyn, you emphasized if it's time for your mammogram, y'all need to stop holding back, go and wear your mask, go to the doctor. I ended up getting my mammogram, fine. I got a colonoscopy. It was the second time I've ever had one, and they found a polyp. And I was thinking, if I had not attended this very, I had been, of course, planning to, I should write a letter to the Black Alumni Association because it was just, to me, it was amazing. I was, of course, in shock that they said I had a polyp. It's interesting. You guys know the process. You wake up and then they tell you what they found and what they removed. You're like, really? Okay. But thank God. I mean, if I had not attended this, I know I wouldn't have gone, at least not as soon. So thank you, thank you, thank you. So I've been trying to get my husband to you need to do the same. He's like a decade older and still won't get it done. But so thank you guys for that.
Caroline, do you guys have kids? You and your husband?
No.
Okay, so the reason I ask that is that when I see, especially us, who and really a lot of males especially don't want it. I always say, well, do you love your wife? And some males will say, of course. I mean, everybody says they love their wife, but so then I say you should get a colonoscopy. You don't want to leave your partner alone. Then they'll say, well, some of them say, well, she'll be fine without me. We're fine.
Oh, no.
And then I said, do you have kids? And people are like, yeah. I'm like, do you love your kids? And they're like, well, what do my kids have to do with it? They'll be fine. I say, well, if you have a polyp, then your kids will get their colonoscopy sooner, and you could save your life, their lives, and generational life. So one thing I would say, Sherilyn, is that if you have sisters, if he has brothers, sisters, or anybody who've had polyps, he should get his colonoscopy also, and I'll harp on him. I'll convince him, Cheryl. So, just give him, have him go to the website, make an appointment, or
okay, yeah, because I was trying to get him to. I told him, listen in here, even if you don't want to show up. Just, I sent the link to him, but he's over there watching the games instead. Yeah.
The games are important.
yes, they're good for your mental something, right?
Yeah,
there's something healthy about that too. Matter. But other things that you guys said, was, again, you know that they're factual, but the fact that I literally still had to fight to get that particular colonoscopy. Mm-hmm. I was having some other problems with my primary doctor. His staff just kept putting me off. I literally had to then contact my OBGYN and say, hey, listen, they're not doing this. They're taking their time and saying, do you really want this? Or you think you really need it? And all that kind of stuff. So she just hooked me right up. Thankful. So again, I had to fight just to get that done. And, I'm thinking I got great medical insurance and everything, and still I have to fight to get the work done, get the appointment.
Some guidelines say 10 years. That's the problem. I mean, our colorectal guidelines are every 5 years. And if you have a polyp, we do it in 3, right? But it's 3 to 5, 5 to 10, things of that nature. But a lot of health systems, a lot of, HMOs are every 10 years, and so, it's hard. And a lot of that has to do with access to, as I was talking to Dr. Cook, access to, specialists. But you really have to advocate for yourself, which is why I think we're here. I mean, Michael Frierson and his son, little Mike, they advocated for themselves. So while he had his colonoscopy, and he was misdiagnosed, they still advocated for themselves when he still had symptoms, or else Michael would not have lived as long as he lived. And one of the biggest things I had to learn here, especially at Cedars-Sinai, was that when I started, I could tell my Black patients, our stereotype that we're aggressive is very, it's not true at all. But because of that stereotype, a lot of doctors have implicit bias, which is why I really struggle with, I really educate a lot of doctors who are of different races and backgrounds. So it's not fear of us, but it's you need a colonoscopy. Oh, I don't want anybody sticking it in my butt. Or I assume you can't afford it. so I don't offer it. I think I'm doing a good thing, things of that nature. But when I started, I could tell my Black patients anything and they would say, okay. Like I was even raised, like I just followed, the rules, right? I wasn't talking to my pediatrician, I wasn't asking questions. I'm a kid, right? And, I was just quiet and all those things. And one thing I've learned culturally, and it's funny how my implicit bias, I have a lot of Jewish patients. And when I started, a lot of my Jewish patients would come in, they would have questions, they would write everything down, they would sit. And I was like, well, maybe because they don't trust me, maybe because I'm Black, maybe because I'm young. I had the reverse. And so it's interesting how, that's something I've adopted with my kids. I make my kids write 3 questions to ask their doctor, things of that nature. And so that's something I adopted, but it hurts us. Implicit bias hurts us multiple ways because a lot of doctors sometimes think they're being nice by not offering certain tests that you can't afford, right? Or, you'll hear, they won't convince you to get a colonoscopy. They'll say, and they're like, oh, they won't want one anyway. So you write down patient refuse, things of that nature. And so it's really important that you guys take what you learn here and learn how to be a healthcare advocate, which means finding a doctor you can work with. And if you don't trust your doctor and your doctor doesn't really trust you, you need to find another primary. That's really, I think, what's really important is that, especially with Google now, and a lot of doctors hate Dr. Google, but you can at least learn a little bit about your disease, and so that way you can ask at least 2 or 3 questions. Doctor will sit down with you. We get pulled in a lot of directions, insurance, our health system. And so a lot of times we're in a hurry, but that's a us problem, it's not a you problem. And so it's important if you're prepared or your doctor is more likely to spend more time with you. And that's something that I really want to harp on.
So then you said, as far as my initial question, and thanks, Cheryl, for trying to give it to me. When I was talking about just a family history, because over the years, the past couple of years, I've heard more doctors, again, and I'm talking about, the ones we hear on TV and such, say that family history isn't as important, for so many different conditions, where it used to be, the first thing, your family history. And now they're saying it's just a small fragment of,
Colorectal cancer is a little, so 8% of colorectal cancer is hereditary genetic syndromes.
Did you say 8 or 80?
8. 8%. So, we have things like FAP, familial adenomatous polyposis, things that are genetic diseases, okay? And, when you look at family history overall, it's important, but you're right, it's not the first thing to ask. But if you have symptoms and you have a family history of cancers, it's important to think about it. As physicians, I think we weren't, like Dr. Cook said, we weren't trained to think about it in people who are younger. And so that has to change. And I think it will, especially with all this attention that's being paid to it.
And Cheryl, I'm glad you brought up, that you had to go back and advocate for yourself. And I think, as Dr. Murrell said, I'm a primary care doctor. I was a primary care doctor for 20 years. You have to have a relationship with your primary care doctor. Just the way the system works for most people these days is your primary care doctor is the one that does the referrals. And, the question is, well, how do you advocate? So I'm just going to ask you, how did you advocate to get your colonoscopy done? You went to your OBGYN, right?
I just called a couple of times. And I think the last call was interesting. And this was most frustrating is his one of the assistants, just, since it had been maybe a month or so that I had been trying to get it, she was like, you still want to do that? Like, since it's been a month since you initially requested it, and I guess I survived, and I was calling again, like it wasn't that important, I guess, because I hadn't been rushed in emergency or something. I just thought it was the most absurd question to ask. Do you still need it? Well, yes. Mm-hmm. So she said she'd get back to me. I immediately hung up the phone and called my OBGYN, who's just a really cool woman I've been with for over 20 years, and said, hey, I called my primary and these people are holding up, and she just said, I'll do it right now. So,
and it was that relationship that did it. So that's sort of my point. You had that ongoing relationship with your OBGYN, and that's all it takes. I'm just really glad that you brought that point up, because you do have to have a relationship. But if you hit a roadblock, you don't want to go there first, but you can ask, you can insist, And then if it still doesn't happen, sometimes you have to complain. So
Hey, look, and I'm gonna tell you something. I want to appreciate you, Sherilyn, for making that comment about how that last meeting affected your decision making. Because I'm gonna tell you, I've had 25 young men under the age of 40 go out and try to get colonoscopies. Only 5 of them were capable of having a colonoscopy done. 3 of them had polyps, and this is under the age of 40. Okay, 2 of them were considered precancerous polyps. Okay, so I'm, once again, and Zuri and I go back and forth about a bunch of things. I'm always picking his brains about things, and it's like, he talks about the processed food issue and the obesity issue, and I think those are serious things that we have to take into consideration in today's society. But those things aren't going away anytime soon. I mean, we're not going to stop using processed foods. We might as well get used to that concept that we're going to be doing processed foods probably at least for the rest of our lives, unless something changes drastically, right? You still shouldn't have to die from colon cancer. I mean, this is a simple process. I mean, if we can get this system to change, and the only reason why the insurance companies won't change the system is that they're playing an actuary game. They would much rather treat you at the tail end of this thing, let you get sick at the tail end of it, not live for a long time instead of treating you early. So I think there has to be a lot of pressure being placed on the insurance companies to be sure that we're looking at this thing appropriately. Now, the great thing is I'm starting to hear a whole lot of physicians, a whole lot of gastroenterologists, and a whole lot of a number of rectal colon surgeons that are saying this. They are saying that we are in an epidemic now. They understand the significance of how many young people are coming into their offices with colon cancer. So, once again, the only thing that you can do, you have to be a strong advocate. You have to fight for this. I mean, and if you have children, your children have to fight for this. They have to fight for this, because this is going to be, if we don't get this under control over the next 10 years, then we're going to really see some problems going down, I think, in the next 10, 15 years.
Yeah. Carl has a question. You got your hand up there.
Yes. First of all, I want to thank Michael and Dr. Murrell for the campaign that you guys have embarked upon. I know that it's a career for Dr. Murrell, but it's also a calling as well. Next week, my son who is 30 years old, and he'll be going in for his first colonoscopy. And how we got there was I was able to share your postings with him on Instagram.
Outstanding.
And so keep doing that. Everyone else who's here, I would encourage you to follow Michael Frierson and Dr. Zuri Murrell on Instagram, or I'm not sure if you're on Facebook. I'm not, but I would encourage you to follow them, because there's a lot of great content that's coming out literally on a daily basis from each of them. And this is a great way for us to educate ourselves, which we can in turn educate our loved ones.
Yeah.
And if I can say one other thing, I'm going to be working with an organization pretty soon. I was in the process of trying to start a nonprofit of my own, and it was just so ridiculously hard to do. It would have taken me 1.5 years to get this thing up and going. I hope that I can come back to one of your meetings, because I'm serious about raising this $200 million. I am not joking about this. We need to get data. We need data. And if we can get a number of people out there that's willing to share the data so that we can get this age reduced, we need to do that. I mean, we need to participate in this, because if we don't care about ourselves, nobody's going to care about us. That's right. And I'm going to tell you, we're going to be affected by this probably the earliest and the most initially. But this is something that's happening not just to Black people. This is happening to people across the racial spectrum. So we really need to we need to find a way to aggressively approach this. And I don't think we have 10 years to waste. I really think we got to get ahead of this.
Yeah, I've got a couple questions that came in. I would like to have Dr. Murrell address this. One is, what is the likelihood of a person who's been diagnosed with a benign polyp to develop more polyps, whether and are they likely to turn into cancerous tumors? And is there anything specific that most people can do to lessen their chances developing these polyps? So as a preventative.
So if we find a polyp, number one is there's 2 types of polyps. There's hyperplastic polyps, which unless you have a large number of those polyps, they don't lead to colon cancer. So that's almost like a negative. If you have adenomatous polyps, we recommend another 3 years because it takes, from what we think it takes from time 0 to about 5 years to go from nothing to a polyp, and maybe time 0 to maybe 7 years, 8 years to go from nothing to a colon cancer. So if you have a polyp, a lot of people, they could be polyp formers, and there's about an 8% miss rate of a second polyp. And so the reason you want to do it again is you want to make sure that you didn't miss any polyps, number one. And you want to see if people are polyp formers. Some people form polyps. The second time that I did my colonoscopy, and I did mine a year later, and you know how hard that was for me to do my own colonoscopy, but I yoga, I do a lot of these things. So I'm joking, Dr. Cook. But anyway, I did get my second.
I was gonna say that's a new one.
And
That would have been absolutely miraculous.
yeah, and I had polyps. I had more polyps. So it is, and that's just a year later. So I'm a polyp former. We really, in answer to your question, we think that perhaps there, if you're a polyp former, maybe there's like a 10% chance, but we don't really know. We don't really know. We think overall with the population, especially young people, we don't know that. And so that's why we advocate for, if you have a polyp, you get another one in 3 years. If that one's normal, then you go to 5 to 10 years. One thing I wanted to go ahead. I'm sorry.
And there's a follow-up question that's related to this, because someone wrote in that their mother was diagnosed with colon cancer at the age of 40, and the individual's turning 39 this year.
They should have had one at 30.
Yep.
They did have one at 30. Yeah, they had one at 30. They switched to more plant-based diet. So they've had 2 colonoscopies at 39. What else should they do to stay healthy? And when should they have their next colonoscopy?
So I would be a little more aggressive. Even if the second time, can you remind me, did they have polyps the second?
Let's see if they said they had polyps. No.
Okay. I would still do it in 3 years.
They had polyps. So it sounds like they had 2 clean colonoscopies.
Colonoscopies. If they had 2 clean colonoscopies, I still, in that particular case, would get, another one in 3 years versus the 5 years.
Okay.
Now, I deal with a lot of my patients, they have to pay for the colonoscopy when they're younger because the insurance just won't do it. Okay. And so if you have the means, then definitely, you should have another one in 3 years. Now, one of the things, especially about a plant-based diet, is I understand what Mike's saying, that we're not going to change, everything with that. But I think it's important to note, when I do a lot of talks, and it's on, African-Americans, why we have a higher rate, risk of higher stage of diagnosis, higher, death rate overall. It is important to note that there really isn't much difference genetically from an African-American and a Caucasian, and especially African-American and an African. I go to do medical missions in Uganda. I operate on everything. I operate on, babies. I do thyroids. I do everything in Africa. You know what I don't operate on in Uganda is colon cancer. Uganda and Nigeria have one of the lowest rates in the world. Why is that? Number one is, and something that's preventative, you guys, that is vitamin D. Vitamin D levels in this country are very low, and you're going to see even lower rates, especially in our young people, because of COVID. People were inside for a long time. Vitamin D helps to literally decrease your inflammatory markers, and helps to boost your immune system. African Americans, we have to be outside longer because melanin is a great thing, but vitamin D is made when the sun hits your skin. Okay. And so a lot of us, we work inside. A lot of Caucasians, all of us, we, work indoors in America. So take your vitamin D. And that's something that can help prevent, polyps and help prevent things. So in Africa, I hate to speak for all Africa. In Uganda, it's a lot of outdoor work. There's not a lot of obesity. And red meat consumption is a big deal. It is an independent risk factor for colon cancer. Now, I remember when I was first there, we stopped at a restaurant. And one thing I learned is their diet is heavy on fiber, low in red meat. If you eat red meat that's as fresh as it is there, it's disgusting. I mean, like the reason we like, or people like red meat is because of all the preservatives and all the other things that, add flavor to it. So they have a mostly high fiber diet, low meat diet. There is not a lot of obesity there, do a lot of outdoor, work. And so those are things that I think are important. There's not a lot of processed foods. And it's important because we can change it for our young people in terms of, fighting a thorough fight in terms of for colonoscopies, but also, healthier. I hate the word healthier choices because food apartheid does not allow that. Okay, and the reason we call it food apartheid is that versus a food desert is that a food apartheid is getting the result that you want, that it's designed for, and we're starting to see an increase now, believe it or not, in India, which traditionally has no colon cancer, small increase in Uganda, small increase in Nigeria, and there it's the rich people who are getting colon cancer. Why is that, right? Traditionally, it's people who die from it traditionally are, lower income because the processed food is cheaper. Well, guess what? In those countries, America has exported our food. So I don't want to, offend anybody, but the fast food restaurants that we all know of and the one you're thinking about now, you can see cancer increase in areas where they are located. Like there is a definite correlation with processed foods. And so because rich people can afford the McDonald's, Taco Bell, all those things, and poor people are eating at home, you're starting to see obesity rates increase in wealthy Indians who live in India, Nigerians, Ugandans, and it is, diet related. Young people is different. We're still trying to, figure that out, which is still diet related, but there's other things going on. We think that that highly processed foods in older people lead to cancer because of what's in them. Okay, like literally the chemicals that are in processed foods. With younger people, it's that, but I think it's also the change in the microbiome and the bacteria that when you consume that much of it, it changes your bacteria and your ability to fight the changes that happen in all of our bodies every single day. And so that is something that I still think is a powerful message that, we should get out, that particular thing may not help you if you're over the age of 50. I mean, I still think it will, just in diabetes and high blood pressure and all that, but you can help your grandkids. You can help your kids in terms of trying to provide, not healthier choices, because people won't make the healthier choices, because a lot of times healthier choices people don't think taste good. Even if you started eating blackberries, blueberries, raspberries, I tell people that all the time, wash them and all those things, but high in fiber, low glycemic index, and there's a lot of phytonutrients, as you know, Dr. Cook, that, we're still learning how that fights, cancer. So, and that's just something that's really important to me. But the hardest thing to change, as is getting people to stop smoking and the obesity epidemic. I mean, it's hard to do those things. So I do agree, like Mike says, that, colonoscopy early, I think, would really make a huge difference. And, at first I told Mike that it's like spitting in the wind, man, that's never going to happen,
Yeah.
And so his passion for it is so immense that, and a lot of doctors believe this, but I think it will change the more young people that, that unfortunately pass away. Chadwick Boseman, after he passed away, I always say that he played superheroes, when he was alive, but he became a superhero when he died. Because this first time in my life, I had so many young African-American males who came in on their own volition. Now, I shouldn't say this in a public forum, but I would ask a lot of detailed questions about symptoms so I can, find some of these symptoms, because they can't have, screening colonoscopy. So I would really thoroughly, have you had rectal bleeding, any constipation, any changes in bowel habits? And, they would, but it was a lot of questioning. And then I would be able to, do their colonoscopies, and I found polyps. I found polyps in, I would say, and this happened after Mike, because Michael sent me a lot of his family and younger people. It's been like 35 to 40%. And you don't know, these people wouldn't have had a colonoscopy until they were 45 or 50, things of that nature, and you can't publish data, because once you find a symptom, then it is not screening anymore, but it is very, it is literally an epidemic that could be prevented, but the cost structure, the access to care, those things are what is preventing people from doing this. So the reason that Michael's, and I'm sorry, Doctor, but one other thing, the reason that Michael's message is so powerful is that, and it's not just the being able to do a study on, 30-year-olds colonoscopy, no symptoms, but that's what it will take, because you will do that. You can actually look at polyp rates in people with no symptoms, and you'll be able to determine that, wow, there's X amount of polyps in these young people that could have gone into cancer, and that's what's really important. I mean, you think about $200 million, somebody just gave Harvard $150 million to build buildings. Dr. Dre gave $88 million to USC. I donate a little bit of money, to Morehouse, because I don't have, I went to Morehouse, donate to Morehouse, and I donate time, and I donate, to causes like this to raise awareness, and it's something that can be done, you guys, and unfortunately, it's going to take something like that in order to not only save people's lives who are actually getting the colonoscopy, but to change America and to save lives of everyone, whether you're Black, white, or whatever. One other important thing is that one of the highest causes of death in Koreans and Korean Americans is colorectal cancer. The reason that happens is, we think, is in addition to all the microbiome and everything, but it's a large consumption of red meat, because of and the way red meat's cooked. We all like a little barbecue, but you're taking meat that already is pro-carcinogenic, then you cook it at high heat, and it becomes like a super cancer possibility. I eat red meat. I tell people, if you eat red meat every single day, and I understand red meat, chuck, beef and all that is cheap. And I understand that. Even if you go to once every 2 weeks, that will still be helpful. I eat red meat maybe once every 3 months. You know what I mean? It's something that I think will help you, but more importantly, it will help your kids when they see how you eat.
And that's the only reason why he's eating that red meat is because I'm taking in the blood cells and we're having ribs and
yeah, but the biggest problem is that people eat. It's hard not to eat like that every day because you're surrounded. Even if I talk about blueberries. There was just a study now. I'm not a study, but they just released the Dirty Dozen, which is foods with the highest pesticides. So now I've had people say, well, what do you think about, blueberries? I mean, they're healthy. You just have to wash them. But the problem really is all the pesticides, it is so, it's such low hanging fruit that, well, don't eat this because we as a society put chemicals in, in things as opposed to stop the chemicals, for instance. But all the things I'm telling you, when you look them up, you may see that, hey, blueberries have just been shown to have a lot of pesticides. You know what? Wash them. All this, wash them. Or get them organic. What people don't understand is that what I tell people is that organic fruit is very expensive. But if you're going to, save up your money and buy it, strawberries, because, they are high in pesticides. So organic helps tremendously. And berries, get organic. And one thing I tell people is that frozen berries have the same effect in terms of fiber and everything as if you had fresh berries. Yeah. And so these are like little nuggets. I try to tell people every morning I take my berries, 2 cups of blackberries, blueberry, raspberries that are, wild berry mix. So 2 cups, a cup of almond milk, because it has 30 calories. And, I'm trying to have my 4-pack because it's hard to get a 6-pack, at least till I'm, for another 5 years. Okay, it's important. And I take ice and I take protein powder, I blend it. And every morning I walk out the house with 14 grams of fiber. Okay, blackberries, raspberries have about 7 grams of fiber per cup. I do 2 cups of that. We need 28 grams of fiber a day, and so I leave with half my fiber requirement out the door. Fiber is important because it helps to decrease the time that carcinogens are in the colon, basically helps you poop quicker, okay? And it helps because constipation in and of itself can, basically anything we eat, has possible carcinogens in it. And you want to help escort that out of your body ASAP. And that's what fiber.
I think this is tying into another question that came in. I just wanted to get to, but it was, what can you do to prevent? And you've pretty much already answered it, but I just want people to keep in mind that there's, prevention of a colon cancer and there's screening. So the colonoscopy is a screening to see if you have cancer or if your colon looks healthy. The diet and the fiber is really sort of the core of
Yeah.
prevention.
Right. But a colonoscopy, I think, is very important in prevention, though, because it, polyps don't have any symptoms until they, get large often. And so I think the diet is incredibly important, but that's like the long-term solution to staying healthy. But I do think a colonoscopy, so there's colonoscopies, you guys, and then there's a FIT test, which are stool tests. I think a colonoscopy is preventative because polyps don't have signs or symptoms, and you take them out when you do a colonoscopy.
Yeah, no, I mean, we clearly need both. But
Yeah,
I'm saying
exactly.
the diet is going to help prevent the polyp from forming in the first place.
And a multitude of diseases. That it's so important.
Absolutely. I mean, it's just interesting when you mentioned Uganda and other countries in Africa. I've known people personally who are diabetic, and then they went and spent a year in a country in Africa, ate the diet there. Guess what? Their diabetes went away.
Yeah, in Mexico, for instance, Mexico has a low obesity rate, right? When people cross the border, okay, when people move here, and they've been here longer than like if they move here and their kids are born here, or if they stay here for longer than, I believe it's 15 years, then they have the same diseases that Americans have, even if they're trying to eat the same diet that they ate in Mexico. I always use this example that I'm lactose intolerant. 70% of people around the world are lactose intolerant. I go to Italy and I can eat gelato, I can eat pasta, I can eat all of these things. If I ate that in America, I would explode. Like literally, I couldn't do it. But there, why can I do that there? Why is it I see so many patients here diagnosed with gluten intolerance, right? It's not really the gluten, it's not really the bread, but it's all the preservatives in it. When you go to, Africa, when you go to a lot of these, Uganda and these other countries, when you go to Italy, when you go to Spain, the Mediterranean diet, it's really because everything is literally organic. Like it's organic. And so it's hard because I always say America is, we have so much food, which is crazy that people are still starving here, but we have so much food, but a lot of it is crap. A lot of it is crap. And it's also, we want things right away. We do. Like we've been trained on that, right? And if everything was organic, if everything was like in Italy, you have to sit down, you have to slow down. And we're such a society of, we work all the time, work ourselves to death, and we got to move, we got to go, right? When you have a meal, as a lot of people here have traveled, when you have a meal that is farm to table, that is organic, you eat actually less, and it's more flavorful. You know what I mean? It's interesting, but unfortunately, a lot of people, you have to have money. Everything's more expensive. Organic's more expensive. All these things are more expensive in America. And that's one of the biggest things is that a lot of people don't have a choice. And we say, well, what do you mean? You don't have a choice. It's things are so expensive. You don't have grocery, you don't have, farmers markets. One of the biggest things I am happy about is that in my church, which is, in the hood, we have a farmers market now that comes out and people come out. A lot of times people, well, you won't come, but people come. People want this, they want this. And that's another thing about implicit bias. Oh, poor people won't do this. They won't, they want McDonald's and all that. And that's another thing that kills, not African Americans. It's, it's people who are poor. And we all know there's more Caucasians in this country that are poor than African Americans. We're only 13% of the population. So I hate to say poor Blacks, but that's what is thought of in this country, And so the reality is all people who are poor, it is hard to eat right. It's hard. And so we need to make more opportunities for that. And if you build it, they will come.
I was going to say, and there's also been numerous studies that have shown that with the movement of gardens in schools, that school children, if they grow the food, they will eat it. People talk about my kid won't eat vegetables. Well, guess what? When they grow the zucchini, they eat the zucchini. So, it's good to see the movement. There's clearly not enough of it, but growing your own food, at least some of it, or buying locally, like you said, from farmers markets is definitely a way to go. But, it's almost like I think people can go to, like you said, roll through fast food, you get an instant meal. sometimes people get vegetables and stuff and they don't know what to do with it. So cooking is a whole nother thing.
Yeah, yeah, because our generation, or the generation right after us, I mean, they weren't taught it. They weren't taught it because fast food's cheaper. You know what I mean? Fast food's cheaper and it smells better and all those things. And in our society, that's you want it quick, and I think that's one of the bigger changes that have to be made. And you need to make organic food more affordable.
Yeah. And you want to know what to do? We get to that point, get a colonoscopy.
Yeah,
well,
I agree.
Colonoscopy.
We need that too. We need that too, but we want to get the diet together because when we get the colonoscopy, we don't want to find a hyperplastic polyp. So.
There you go. You made me feel bad about this. I had a nice whole grain bowl today with beans and brown rice and vegetables, but it was a frozen one, so I had to heat it up for 5 minutes in the microwave.
But frozen berries. So I guess what I'm saying is that fresh berries are more expensive than frozen, so you still get the same health. So when I do a lot of these talks, I tell people that frozen berries you can still use those also, and they're still the same as fresh berries.
It's particularly in smoothies. I mean,
right.
They're great. I think Carly has a question though. If we can go to Carly, you can unmute yourself.
Hi, good evening, everybody. Thank you so much for all this information. This is my first one of these. I've been invited for a couple, but this is the first time I've been able to attend. And I apologize, I was a little bit late, but you were just talking about diet and the berries and, whole grains. Is there a resource for dummies on what we should be eating? I know somebody had mentioned, changing to a plant-based diet, and you talked about red meat and some of the concerns with the overcooking and all of that. Is there a resource or someplace something you can share with us?
Dr. Murrell's Instagram.
Okay.
Yeah, I do a lot of, that's one of the biggest things I harp on. There's a book that some people used to think was kind of pseudoscience, but it's borne out, and they do have studies in there. It's called How Not to Die.
Oh, yeah.
And that's the one that Bill Clinton read and became a vegan. It does talk about like phytonutrients, berries, things of that nature. I think that I agree with Mike that is a huge problem, and we're a capitalist society, and so that's going to take a lot of change. And so I do believe that colonoscopies in younger people are important too, because that they've already been exposed to. Because we have not made these changes, they've already been exposed to so many highly processed foods and all these other things, changes the microbiome, that you have to do that until we catch up with everything else. The biggest thing is that everybody will say that's not realistic, but I do think that you get the word out, and people start advocating for themselves, and things will change. I think it's still going to take a large number of young people to die from it, and it's going to take the right one to die. Everybody talks about Chadwick Boseman, and that did increase screening for African Americans. Ryan Reynolds, they found a polyp in, and that actually had a huge impact. You know what I mean? So people sharing these stories. I take care of a lot of celebrities, and it always is interesting when I give these talks and there's a celebrity actor on the panel. People are so enthralled with that they'll listen more than if I say something, So I've done colonoscopies on some who let me, we film it and then we talk about it, like my man Kevin Frazier. We did it for Entertainment Tonight, and that had a big impact because we're not ashamed, they're not ashamed of it. The truth is, though, there's still a lot of misinformation, and there's a lot of embarrassment. I always say you shouldn't die from fear, and you shouldn't die from embarrassment. I make people say at all these talks, especially at church, in the middle of when I get up there to speak after the preacher, I make everybody say the words colon, rectum, and anus. And I say you shouldn't die from fear, and you shouldn't die from embarrassment. The biggest time to talk about this, believe it or not, is at the dinner table. My dad is hilarious because he is an educated man, but every time I would say the word rectum, I'm like colorectal. He's like, oh, rectum. Like that really is the word that is the taboo subject. When I go on TV shows, they will say everything, you can say whatever, but try not to say rectum and anus, and even I still do, but they'll stumble over those words. You can look at on my website, I did Home and Family, and this guy is a great host, but he was like colon rectal. Like people still have this. Some people think colon cancer comes from anal sex. Now, I don't care what kind of sex you have, but it doesn't. You know what I mean? And people are afraid that if you have rectal cancer, anal cancer could be related to, HPV, but rectal cancer is not. There's all of these, these taboos that we have, and this is in all communities. And people are afraid of colonoscopy. Everybody on here who's had one, I mean, we were just talking about it. It is the best sleep you'll ever have. And some people always know somebody who I had a complication with my colonoscopy. That is so rare. It's like 1%. It's not even 1%. It's like 0.3% have an issue with a screening colonoscopy. Okay, the diagnostic, sometimes you have a higher rate of complications because you're looking for something that is a problem. Okay, but in a screening colonoscopy, it's very, very, very rare to have that complication. So all of the reasons that people don't, the biggest one in a young person is money, because people, they can't get it. And that's real. But in people who just don't want one, especially if you're over 65 and you have Medicare where the whole thing is paid for, it's getting to the point where my grandmother passed away from not from laryngeal cancer. She had laryngeal cancer 40 years before she died because of smoking. Now, I'm not mad at her because there was this is the cigarettes of doctors. Doctors smoke in the hospital. There's still ashtrays from before at Harbor, UCLA. You can find some rooms with ashtrays, right? I mean, you can't smoke there anymore, but you can find that's what used to happen in a hospital. She died at 93. I'm not mad at her. But I'll be honest with you, smokers now, you should know, I believe they should pay higher insurance rates. I believe that, a lot of these things should cost more because the dangers. You know what I'm saying? And so the whole thing with colorectal cancer is that we still don't know exactly why. But if you're over the age of 65 and you don't get any of these tests, it is twofold. Number one is if the doctor did not explain it to you enough. But number two, like Charlene was saying, I'll talk to your husband because there's just no reason unless you don't have, if you don't have insurance, you can't afford it, nobody do it for you. That's one thing, but you got to get it. I'm so passionate about this for any age group, but you have to remember, only 70%, I work with the American Cancer Society and we had this whole thing by 80% by 2018 means you have to have some form of screening by 2018 for colon cancer, okay? Whether it's the FIT test, the Cologuard test, or colonoscopy. We got it to 60% of all Americans, 60. And these are for people over the age of 45 to 50, hardcore campaign. Now that's great. We raised it 50 to maybe almost 70%, but we still cannot even get to 80% in the traditional group that needs a colonoscopy or a FIT test, let alone if someone's younger. So we have a lot of work to do.
I hate to cut this off, but we're actually over time. And we have another question. If you could just answer this really briefly, Dr. Murrell, then I'm going to turn it back over to Carl to close us out. But the question was, basically the statement was, I've never had a colonoscopy. How long does it take? How long is the procedure?
So traditionally, you have to get there about an hour before. So you clean out, you take a prep the day before your colonoscopy. You basically, it's a solution to clean yourself out. Then you
Just the worst part.
Yeah, it's the worst part. But I'll be honest with you, the prep I use is a Miralax and coconut water or any kind of beverage you like. I do mine once a year. I do it on January the 2nd. I do a prep. My wife does a bowel prep to clean ourselves out. Not because I think you have meat in the colon for a long time or any of that, but because you can't help but eat some kind of carcinogens or be sometimes constipated, things of that nature. I start my new year off with a clean colon. So anyway, the procedure itself takes a good colonoscopy takes at least 25 minutes. So what happens is once you go in, you really look for polyps on the way out. And so that is very important. But it doesn't take usually more than 30 minutes unless you have a lot of polyps. Michael's took a long time because Mike had, at this point, there was a lot going on there, and that should have never been there. But it's very important. And then, Dr. Cook, can I just say one more thing? Michael's story, and if Mike could keep it to 2 minutes, I don't know, he likes to talk like I do, but he usually closes out because this man went through so much. His son was so amazing. And if I was at my other office, I'd have his picture. It is a testament to this man. I wish you guys could have met him. He was so positive and amazing. And he, as a surgeon, I never watched people die, ever. You know, I operate people, nobody dies on my table. Nobody dies in front of me because I operate, and if cancer comes back, it's the oncologist that takes care of it. You know, and so I've never seen this. I was with Mike like to the end.
Yeah.
And I not only, I'm always sympathetic, but I am so empathetic to this, and it shouldn't have happened. And for most people, if you catch it early, it does not happen like this, you know? And so, Mike, I don't know if you wanted to add two things.
The only thing I want to say is that, you know, since I've been involved with this, I've met so many Michaels that it makes me want to cry. I mean, and I didn't cry when my son died, but I see so much of this now. I mean, this is so prevalent right now in this under 40 crowd, and we got to do better, man. I mean, we're better than this. I think we're better than this as a country, because we're not going to pay attention to this younger population, you know, and make sure that they're taken care of. And me being a senior citizen, I mean, if the senior people in this country aren't stepping up to support whatever we need to do to get a handle on this, then we're doing something really, really wrong, because this situation is going to be out of control in 10 years. It's going to be out of control in 10 years. So we really need to get on top of this. We need to do whatever we need to do to make sure that this younger generation ain't suffering through this, because it's not a pretty thing to see, and it's not pretty to die from this.
Yeah. By 2030, most of the people who have colon cancer will be, especially the way it's going with our rates, you know, will be under the age of 50, 55. Like this is real, you know, and you know, it's multifactorial. I mean, there's still not a lot of people who, you know, there's still a large percent of people who traditionally need to be screened who are not, let alone this generation. But this generation, the one good thing about it, and I struggle, especially with hiring this generation, because, you know, as much as they, as you know, we don't think they work as hard, things of that nature, they do advocate for themselves, and they spread the word with social media. And so that's one of the biggest things is I get most of my patients now from TikTok. I don't dance on TikTok, but I give information, and for Instagram. And that's why I actually, you know, I have a subspecialty where I see all these young patients. Right before I got on this call, I was in the hospital. I told Mike, 31-year-old, 31 years old, who I'm gonna have to operate on in probably 2 to 3 days with colon cancer. This is real.
Thank you so much, Dr. Murrell and Mr. Frierson. I mean, it's a very, very important topic for all of us. And I'm going to turn it over to Carl, because you had some comments you wanted to make about the Alumni Association.
First off, I want to thank all of the viewers who joined us today. I hope that this was worth your while. I know that it was worth your while. And please share it with your loved ones. It will be available via YouTube shortly, and you will be able to share this around. Secondly, I want to thank our panelists, Michael Frierson, a longtime friend of mine, and it's just terrible to see what you've gone through, but you're making serious lemonade out of this lemon, and I want to thank you for that. Dr. Murrell, thank you for the work that you do, as well as the campaign that you're on, aside from just the practice of the work, but to work to prevent this. Dr. Cook, always available for anything that we need, and I'm just so grateful for that. Thank you very much. This event has been brought to you by the Black Alumni and Friends chapter of Cal Poly Pomona, which I serve on the board. I also serve on the alumni board of Cal Poly Pomona. And we have several of our board members on the call with us. Our president, Corey Gaither, Natalia, Sandy White, Fred Jackson. Thank you for being here. And we're a small and mighty group. We would encourage you to join us because we're working to do very good work to support not only our alumni, but also our Black students on campus. And so we really need your assistance. So take a look at Cal Poly Pomona Black Alumni and Friends. Please join and engage with us. We'll be putting on additional events. We try to do something at the very least once a month. Thank you.
Thank you all. This is priceless. Appreciate it.
Thank you all. Take care. And if you haven't got your screenings done from COVID, get in there.